Recently, we talked about alar base elevation. That's because we perform a lot of alar base elevation procedures at our clinic. And along with alar base elevation, the surgeries we most often perform together are those related to the columella. So today, I'd like to talk about two types of surgeries related to the columella. One is a surgery to raise the columella, and the other is a procedure to reinforce a recessed columella. Columella reinforcement is also sometimes called columella lowering. Let me explain a bit about these two procedures. The columella, as the name suggests, refers to the column between the nostrils in the center of the nose. So the volume of the columella is actually very important. If the columella is extremely sunken or hangs down too much, it can become an aesthetic issue. For example, when the columella is drooping. If the columella is drooping naturally, the nose looks longer from the front, so it can look a bit like a witch's nose or a droopy nose, making it look awkward and aesthetically unpleasing. From the side, if the columella hangs down, it gives the impression that the nostrils are too large. That's why this kind of drooping columella needs to be corrected by lifting the columella. There are mainly two ways to lift the columella. One is that, to address the drooping columella, you need to understand the anatomical structure of that area. Sometimes the septal cartilage in the center of the nose is drooping, or the inner leg of the alar cartilage, the lower lateral cartilage, is hanging down. So if the septal cartilage is drooping or the alar cartilage is drooping, when you look at it this way, if the septal cartilage is drooping, you need to trim the lower part that's sagging a bit. Of course, this should always be done within the boundaries that maintain the structural stability. In the case where the alar cartilage is drooping, you can also trim it, but it's not a very large structure. So rather than trimming it too aggressively, you lift it upward and fix it to the inner structure. This is sometimes called the suspension method, and correct it by lifting it up. By doing this, you can reinforce the columella that looks awkward because it droops down too long. It's often done together with nose surgery, but it can also be performed on its own. So, for those who are concerned because their nose droops and looks long, this is a simple method that doesn't require full nose surgery, and the recovery is very quick. So please keep this in mind. If the columella is raised, or in cases of columella retraction, correction is also necessary. This surgery too is not particularly complicated. So what's the first step? The simplest method is just to reinforce the tissue. Since it's sunken, you can use ear cartilage, other tissues, or even dermis. Anything is fine. Of course, cartilage is firmer and less likely to be absorbed, so it tends to be more effective. In this way, you can reinforce the tissue to correct columella retraction. Another case is when the columella is severely retracted, so much so that the skin in that area is extremely tight. In such cases, simply reinforcing the tissue may not be enough. In such cases, when performing septal extension, usually septal extension surgery involves attaching additional cartilage to the septal cartilage to raise the nasal tip and reinforce its length. Similarly, you perform septal extension downward. This way, you can firmly provide the force to bring the lower part of the nose down. So, for firmly pulling the nose downward like that, septal extension surgery is effective. And another advantage of these two methods, especially the second one, is that some people have the upper part of the philtrum completely sunken in, making the philtrum look longer. In such cases, by appropriately using these methods, you can even adjust the length of the philtrum to some extent. This gives the face a bit more dimension and can even make the face appear smaller. The surgery we commonly perform is nostril lift surgery. We often do this together with columella reinforcement. In many cases, the nostrils are drooping while the columella is sunken. In such cases, if you lift the nostrils and enhance the columella, you can achieve an ideal nostril shape that, when viewed from the side, appears as a thin line of about 1 millimeter. If your side profile looks a bit awkward, or if your columella is not visible or appears to hang down too much when viewed from the front, you might want to consider this type of surgery.